Because of the approaching hurricane, we wanted to help you get ready for whatever comes our way. So we're joined in studio by Dr. Kalani Brady with the John A. Burns School of Medicine to talk about what you should have in your emergency kit, including your medical needs. Good morning. Welcome back, Doctor.
Good morning.
Nice to see you.
Good to see you.
Good to see you. Okay, so first of all, in terms of emergency kit, talk about the basics and what people need.
Well, the first thing to have is a portable radio with lots of batteries. And as a matter of fact, you probably can't have too many batteries of D, C, AA, AAA, whatever your battery supplies require, be sure to get your batteries today. Flashlights, more than one, are probably reasonable because power outages with this hurricane force winds will likely cause power outages, and we want to be able to have light in the homes. So this list, by the way, is courtesy of American Red Cross. So 14-day supply of canned or non-perishable foods. This is where the Spam is important. Corned beef hash is important. Rice, obviously, is important. The rice cooker you may have to use. If there's a power outage, you may have to use a hibachi with charcoal or a camp stove with fuel, but have your rice. Manual can opener. It doesn't help if the power goes out and we have an electric can opener.
Right.
Can't open the cans. Matches or a lighter, disposable plates and kitchen utensils, a 14-day supply of water. I know that water is available still today. It's common to sell out water before a hurricane like this, and so I would get your water today. Extra pet food if you have a pet, a cell phone, and a landline telephone because the cell phone site knocks out and then we have to refer to a landline. And then a storage suitcase or a duffel bag. Those would be the general things to keep ready for tomorrow.
What about medical needs? What should people keep in mind?
Medical. First of all, a 14 to 30-day supply of all medications, especially heart medications and diabetes medications, and they should be stored in waterproof Ziploc containers so that we don't end up with water dissolving the pills. That has happened. Special medical information, such as a medical summary in case, God forbid, something happens during the hurricane, personal identification, and insurance cards for if you need to go to the hospital or the doctor. Eyeglasses, that's a no-brainer, but always have a spare pair of eyeglasses around. Toothpaste and toothbrush, dentures, a change of clothes and towels, extra oxygen if you're on oxygen, dialysis per the instructions of the dialysis center, medical diapers if needed, and toilet paper. Let's not forget the toilet paper.
What about evacuating or moving patients or our kupuna?
You know, when we need to move our patients, if it's for a medical reason, consider 911. Otherwise, we should stay off the roads. We shouldn't be out watching the hurricane because we want the roads to be clear for emergency personnel. When you're moving your kupuna, if it's to your house where it's more secure than their house perhaps, move them in, have all their supplies that we've just talked about, and stay the duration of the 3 or 4 days where the weather is at its worst.
And you've been working with patients on Molokai for a long time. What about any concerns there? Because sometimes they might feel isolated. What do you want to say about that?
We have I'm biased, of course, but we have a very good system of nurses, nurses' aides, homemakers in Kalaupapa, and we have a care home. The medical care is provided 24/7 by the nurses, and I'm paged frequently, which is how we handle medical questions in Kalaupapa. So those patients are used to, we have drills for emergencies, and they're used to having emergencies there.
Okay, so they're ready for this as well.
They're ready.
All right, everybody needs to be ready. That doesn't just mean food and water, but it means our medical needs and our health. Thank you so much, Dr. Brady, for joining us for this special edition on Wednesday.
My pleasure.